morning, 23 states are seeing a spike in coronavirus cases. I spoke with Dr. Arthur Pancioli, head of the College of Emergency Medicine at the University of Cincinnati, and he confirms hospitals are seeing more cases of the virus here, too. Dr. Pancioli, good to see you again. Good morning.
Good morning, Sheila.
So let's start here in our area where the governor last week said we're seeing a surge in coronavirus cases. What have you been seeing at UC Medical Center?
Well, all across the system, we're saying the same thing, and indeed we are seeing it at UC, and that is an increase in the number of cases overall, both in the testing centers and in the emergency department.
Are you and your staff better prepared to handle this now than you were a few months ago when the pandemic started?
Undeniably. You know, we all know so much more about this process. This was truly unknown to us 6 months ago, and the first onset of this surprised a lot of people across the world, and we were among them. You know, with the new need for PPE, the shortages of PPE, we were always safe and we always did well, but we've learned a lot more.
What are some things you still need to learn about the virus? I was talking to a nurse just a couple of days ago who said there's still a lot we don't know.
Oh, sure. You know, there's still the unexplained, why do some people get so very sick and others don't? Undeniably, people with underlying conditions are going to suffer more from almost any infectious process. But this one really has some nuances that we don't yet understand.
So we're seeing now people across the country the last few weeks, almost a month now, gathering in large group, whether it's at a protest or a rally or a graduation party or on vacation. What do you think when you see scenes like that?
Well, tragically, I think about math. And this won't hurt, I promise, when I explain math. The simple fact is, the more people in a population that have a disease, and the more people who encounter each other, and the less people who are wearing masks or being protective, those three variables work against us. And we have seen our rate of infections climbing because more people are getting it, more people are encountering each other, and unfortunately people are tired and they're not being quite as aggressive at self-protection and the protection of others.
Yeah, let's talk about that. The fact that people are getting tired of hearing the precautions, maybe tired of being told what to do. I've heard a lot of experts talking about this, and some people don't know who to trust. What do you, as someone who's seeing this virus every day and dealing with it, what do you want people to know?
Yeah, it's time to be smart. You know, our state locked down well, and we really diminished the numbers of people infected. And our numbers are still relatively low compared to other states. But even a small increase in the percentage of the people who have it, and what appears to be a fairly large increase in people running into each other and not social distancing, that's going to lead to so much more of a spiral that we just don't need.
So what do you hope people do?
Well, let's just come back to being thoughtful. Masks really matter. Moderation really matters. Protecting the vulnerable really matters. All right? Let's be smart. Let's keep this controlled, and let's not get sick if we don't need to.
All right. Dr. Arthur Pancioli, University of Cincinnati Medicine, thank you so much for your thoughts today. We really appreciate it.
Thank you. Be safe.
You too.